Hi, I'm Jeremy Clark, CEO of Hilton Head Regional Healthcare, and I'm joined here today by Dr. Randy Evans, one of our board-certified intensivists and pulmonologists. Dr. Evans, thanks for joining me today.
My pleasure, thank you.
You know, this is another episode of Candid on COVID, and we're using these to really talk about what's going on during these unprecedented times. And what we thought we'd do today was really show everyone one of the things we've been talking about. So we are standing here today in our post-anesthesia care unit. This is usually where patients come to after they've had surgery. But today we've actually converted it into an ICU, into an intensive care unit, and we've got this bay set up as an ICU bed would be. And we're doing this in case we see a surge of patients who need critical care. So we've got 12 ICU beds in our hospital, but we're doing this so that we can expand that care. We increase the number of patients that we can take care of. So Dr. Evans, maybe tell me a little bit about what you see. You spend a lot of time in the ICU. Tell me a little bit about what you see when you're looking around here.
So the first thing, to make a point, that we've long had contingency plans to be able to expand our critical care services should the need arise. So with this, we've obviously formalized that a lot more. We've identified areas where we can expand the care and identified the hardware that we need and the staffing, and that's all in place and has not been an issue. So we recreated what's exactly like what's in the intensive care unit in terms of the ICU bed, which is actually very important. We've got all the suction, the monitor, and everything that you might need. Now, this is actually an anesthesia machine. So we brought that in as an example of other options to provide ventilatory support should the need arise. So we have plenty of options to provide ventilator support in various places to meet whatever kind of capacity we need.
Yeah, I think all too often people ask the question of the hospitals, how many vents do you have? How many ventilators do you have? And that's really not the right question. It's how many patients can you provide ventilator assistance for, and using things like our anesthesia machines, our BiPAPs, we're able to do that.
Right.
So, Dr. Evans, I really appreciate you joining me here today for another episode of Candid on COVID.